Good evening. Active cases of COVID-19 have dropped by more than 25% in recent weeks.
On the night beat, KOLOLAND's Dan Stantello breaks down the numbers and talks with local health professionals. Good evening, Dan.
Well, good evening, Don. In less than a month, the number of active COVID-19 cases in South Dakota has dropped by just over 2,000. Statewide data on the recent peak of September 20th told us that there were 7,927 cases of COVID-19 in South Dakota. Less than a month later, today on October 15th, the number is 5,868, a drop of more than 25%. When you compare those two dates, September 20th and October 15th, there is a drop in hospitalizations too, but it's not as pronounced. The data on September 20th included 202 hospitalizations. Today, on the 15th of October, the latest data shows 185 hospitalizations, a drop of a little over 8%.
What we are seeing now is kind of a leveling off of our number of COVID patients at approximately 100 inpatients through the system, and that's kind of where we've been hovering over the last 1 to 2 weeks.
Our numbers for hospitalizations are still actually going up. We're currently at about 211 or so hospitalizations throughout the system.
South Dakota hospitalization and active case numbers are better in recent weeks. Still, concerns persist for these health systems.
But we are still very much bumping right up against our maximum capacity.
We are extremely busy beyond just COVID, so our intensive care units are full. We have the healthcare worker shortage, and all of that decreases our access for our patients.
Coming up in my Eye on KOLOLAND next Wednesday, I'm going to take a closer look at burnout among healthcare workers who help patients with COVID-19.